Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Sodium nitroprusside. Sodium nitroprusside is also a dilator, venodilator and arteriolar dilator. It is a fastest acting drug and it is a short acting drug. The half life of sodium nitroprusside is just 10 to 15 minutes. It is a vasodilator. It dilates the veins and it is also an arterial dilator. So it is a combined venodilator and arterial dilator. It is mainly given in IV in the dosage of 0.5 to 1 milligram per kg per milligram per kg. So this sodium nitroprusside is a fast acting combined vasodilator. It is unstable compound. Because the sodium nitroprusside is unstable, this should be freshly prepared, and once it is freshly prepared, it is covered with black paper or brown paper to prevent the oxidation of the or reaction of the sodium nitroprusside. Mechanism of action of sodium nitroprusside. So this sodium nitroprusside will produce nitric oxide release. It will release nitric oxide. The nitric oxide which is released will activate the cyclic GMP. It will activate the cyclic GMP. When cyclic GMP is activated, it will cause dephosphorylation. It will cause dephosphorylation of the myosin light chain kinase occurs, and because of the dephosphorylation of myosin light chain kinase, there occurs relaxation of the smooth muscles of the blood vessels is seen. This relaxation of smooth muscles will result in vasodilatation. So tolerance will not develop, is not seen due to the sodium nitroprusside. Actually, the nitric oxide releasers like nitrates show tolerance. They develop tolerance on usage of nitrates, but no tolerance develops due to sodium nitroprusside usage. Uses of sodium nitroprusside. Sodium nitroprusside is used in hypertensive emergencies. It can be used in hypertensive emergency. Then side effect of sodium nitroprussides. Sodium nitroprusside will cause excessive hypotension is seen, and this excessive it is causes excessive hypotension. So it can be used, the sodium nitroprusside can be used for producing controlled hypotension in certain conditions, and it can be used for arrhythmias. It is volatile in light, and thus because it is volatile in light, it is stored in brown colored or black colored bottles. Because on reaction with light it can undergo some reactions, so it is stored in bottles which are wrapped with black or brown paper. Then contraindications of sodium nitroprusside. Sodium nitroprusside is contraindicated in pregnancy because sodium nitroprusside releases nitrate, so it can cause methemoglobinemia can be seen in the with sodium nitroprusside also. It can result in cyanide toxicity. When it results in cyanide toxicity, the drug of choice for cyanide toxicity is amyl nitrite, or sodium nitrite is the drug of choice for cyanide toxicity. There is also thiocyanate toxicity is seen. In thiocyanate toxicity, so prolonged infusion, whenever this thiocyanate toxicity mainly occurs on prolonged, if the person prolongedly, or if there is high infusion of sodium nitroprusside for a longer period of time. If sodium nitroprusside is injected for a longer period of time, in such cases there is thiocyanate will accumulate. This thiocyanate which accumulates will result in cyanosis, and it will also cause seizures in the patients. So during this thiocyanate toxicity, it can be treated by giving hydroxycobalamin, right? um, so this sodium nitroprusside nowadays it is not used for the treatment of emergency hypertension, but this can be used. This sodium nitroprusside, actually nowadays this sodium nitroprusside is combined with a beta blocker, and this is reserved for the treatment It is used for the treatment of emergency hypertension, especially in patients with aortic dissection. It is used in patients with aortic dissection.
Thank you and thank you for watching.